Today, we're diving into something you've probably never seen, but it's working behind the scenes to save lives all over the world. It's this incredible digital nervous system for global health. We're going to pull back the curtain and see exactly how this thing actually works. I mean, just think about that question for a second. It's pretty terrifying, right? For way too long, that was the reality. How do you decide where to send vaccines or doctors when you have no idea where an outbreak is hitting the hardest? Making those life or death calls without good, fast data. Well, it's like trying to fly a plane in a hurricane, completely blind. And this is what that looked like. Seriously, picture health workers in tiny, remote villages filling out stacks and stacks of paper forms. Those forms then had to travel for weeks, maybe even months, to get to a central office. By the time anyone actually looked at the data, the situation on the ground was completely different. A small cluster of cases could explode into a full-blown epidemic before the capital even knew there was a problem. Okay, so that's the massive problem that DHIS2 was designed to fix. And that nervous system analogy, it's perfect. The individual clinics, they're like the nerve endings, the sensors. They feel what's happening on the ground. DHIS2 is the spinal cord, shooting those signals instantly to the brain, which in this case is the Ministry of Health. They get the info and can coordinate a fast, smart response. So how does this whole digital nervous system actually communicate? What makes it all tick? Well, the secret sauce is something called a web API. And to really get it, we're going to do something a little different today. We're going to peek inside the system's official rulebook, the DHIS2 Developer Manual. At its heart, the API is that common language. It's basically a set of rules that lets all the different pieces of the health system, whether it's a mobile app, a hospital's database, or a government dashboard, talk to the main DHIS2 platform without any confusion. It makes sure everyone is speaking the exact same data dialect. And yeah, our main source for this whole explainer is this document, the Developer Manual. Now, I know what you're thinking, but this is not some boring technical guide. This is the blueprint. It's the official dictionary for this incredibly powerful language that's literally changing global health. All right, let's zoom in a bit. How do we get from abstract code in a manual to something that actually helps a patient in a clinic? How does that translation happen? It really boils down to this simple three-step process, super logical. First, you have to define the world you want to measure. Then you collect the facts from that world. And finally, you ask questions about those facts to get the answers you need. Let's break that down. So step one is all about creating the vocabulary. In the tech world, they call this metadata. Before you can report a case of malaria, the system has to know what malaria is. Before a clinic can send it a report, the system has to know that clinic even exists. Metadata is essentially the digital twin of the entire health system. Every clinic, every supply, every data point. And check this out. This is an actual example right out of the manual. This is how you digitally define a real-world clinic, or what they call an organization unit. Of course, it needs a name, a unique ID, but look at that parent UID. That's the crucial part. It tells the system who this clinic reports to. That's how you build the whole hierarchy, from a tiny village health post all the way up to the national ministry. Okay, so once the entire structure is built with metadata, it's time to collect the facts. These are the data values. This is the real information, the actual numbers that are flowing in from clinics day in and day out, all using that common API language we talked about. And this is what that data looks like when it's all packaged up. Now, it might look like scary code, but it's not. It's just a super organized digital message. It's saying, this specific clinic for this specific time period is reporting a value of 1 for this specific thing we're tracking. Think of it as a digital postcard sent from the front lines of healthcare. But here's what's really cool. This language isn't just for one type of message. It's super flexible. Let's look at how the system uses the exact same language for two totally different kinds of conversations. So on the one hand, you have this kind of conversation. This is for setting up the system itself. The parameters here are asking big foundational questions like, should I just check this data or should I commit it to the database? Or when I get new clinic info, should I create a new record or just update the one I already have? This is the slow, careful work of building the structure. Now compare that to this conversation. This is the fast, daily chatter of reporting data. See how the parameters are different? They're all about speed and efficiency, like skip a check if you know the data is new to improve performance. It's the same core language, but now it's being used for a much quicker, day-to-day exchange of vital information. And this is where it all comes together and gets really powerful. Because that API is an open, universal language, DHIS2 isn't just some closed-off database. It's a platform for massive innovation. Because it's open, it means anyone can build tools that speak the DHIS2 language. And that has led to this incredible explosion of creativity. People are building custom apps for tracking specific diseases like HIV, live dashboards so health ministers can see outbreaks in real time, and mobile tools that work offline for health workers in the middle of nowhere. And here's a perfect little gem I found buried in the manual's appendix. It talks about connecting DHIS2 directly to R. Now, R is a super powerful programming language that data scientists and top-level statisticians use for serious research. The fact that the system is built to do this shows it's not just for basic reporting. It's ready for some really cutting-edge analysis. So, the biggest takeaway here is that DHIS2 isn't a closed box at all. It provides the foundation, that common language, and then it basically invites the entire global health community to come and build on top of it. It's a truly collaborative way to tackle some of the world's biggest health problems. So what started out as a pretty technical document, a dictionary for a digital language, has become the blueprint for a global standard. It's the code that powers this digital nervous system, creating this perfect, unbroken chain, from a single piece of data in a tiny clinic to a critical decision made in a capital city, and ultimately to lives being saved. And that kind of leaves us with one last big thought to chew on. Platforms like DHIS2 are making these amazing data tools more accessible than ever before, which is fantastic. But if data truly is the new medicine, the next great challenge is figuring out how we make sure that every single community, no matter how remote or poor, gets access to that prescription.